Next topic is first aid for heart disease. First aid means if there is somebody who is showing the symptoms which you have seen just now that are related to heart disease, then what can be done in that condition when you don't have a doctor around? First, you have to call 108 number. This number is for ambulance, free ambulance service. Then you have to check whether the patient is conscious or unconscious by shaking the shoulders. Keep the patient lying on the back on horizontal position. That means the patient who is showing symptoms of heart attack should not be made to stand or sit on chair. By the time the ambulance is coming, the patient should be sleeping straight in horizontal position and on some hard surface, means on the floor, and perform compression only like support. The short form is COLS. Like this is a method which helps us to keep the heart in working position. You must have seen in many movies where people with their hands they press the chest, the heart, the part of the thorax where the heart is present, left side of the chest. They press it with their hands slowly, and they keep on counting. So that counting is given here for at least 30 times. 30 times you have to press the heart and leave, press and leave. This has to be done 30 times at a rate of 100 to 120 strokes per minute. That is, after one press you have to wait and then again press, wait. That time period they are showing. So this can help to keep the patient conscious, help his heart to work little bit by the time you reach to the hospital and get a medical help. Next important topic of this chapter is misuse of medicines. This is very important for us to know because nowadays this is becoming very common and it's really something that shouldn't be happening. So how medicines are misused by people? So here you will see that they are saying that some people, what they do, they take medicines without taking prescription from the doctor. What does this mean? Means sometimes some people, if they are not well, if they have fever, cold, cough, they will just go to a medical shop. They will tell him some name of medicine. They will take it on their own. And sometimes what happens, in some that medicine will suit some people but it doesn't suit some people. Why it doesn't suit? Because of overdose. People are not aware about the concentration of the medicine. That concentration is very important. It decides whether it will suit your body or no. So sometimes overdose of medicine can have very serious problems. Like for example, if somebody is taking painkiller, any medicine which is a painkiller, if overdose of such painkiller is taken, then it may damage your nervous system. Working of your brain can be hampered completely. Excretory system can be damaged. Liver can be damaged. Now you all have studied the importance of this systems in our body. Imagine if they are damaged, what will happen to the body? Then how to identify painkillers, children? Any medicine which has a component, a chemical called as paracetamol, that means it is a painkiller. The name of the medicine will not be paracetamol. Paracetamol is present in its components. So if you check the packing of the medicine, in the composition of the medicine, if paracetamol is written, that means it is a painkiller. So if possible, painkillers should be avoided. Next example of misuse of medicine is overdose of antibiotics. Any antibiotic, if it is taken in more number or in higher concentration, it may lead to nausea, stomachache, dysentery, rash, white patches on the tongue, etc. Nausea is a feeling where you don't feel normal, you feel uneasy, you feel like vomiting, but the person cannot vomit. Next important topic is generic medicines. This is very interesting and useful topic. Generic medicines are actually medicines which are available at a very low cost. They are not very costly. So even it's a plus point that people who cannot afford very costly medicines, they can buy generic medicines, and these generic medicines nowadays are present very easily in almost all chemist shop. So generic medicines are also called as general medicines. What is the difference between those costly medicines and generic medicines? It is manufactured by the medicine producing company itself. Okay, it is not made at a very lower level, or the if the cost is low, that doesn't mean the quality is low. No, these generic medicines are equally of good quality, they are effective. The only difference is these generic medicines do not have a patent. They are distributed in the market without any patent. Okay, any patent means nobody or no company has any approval or claim that that medicine only they have invented and only they can manufacture. No, and even other companies can manufacture, nobody has a patent, and that is why the cost of these medicines is very less. Okay, and they are of very good quality. They have given a word over here, they are at par in quality. That means they are equally have a very good quality as other branded medicines. Now the cost that the medicine causes for its production, that is also less.